The Nigeria Center for Disease Control reported 226 new cases of coronavirus overnight, taking the country's total number of cases to 6,401. Lagos again recorded the highest number of cases with 131, followed by Ogun State with 25, Plateau has 15, Edo 11, Kaduna 7, Oyo 6. Abuja and Adamawa have 5 cases each. Jigawa, Ebonyi and Borno State each had 4 cases, Nasarawa 3, Bauchi and Gombe 2 cases each, while Enugu and Bayelsa have 1 case each. So far, 1,734 patients have been discharged, while the country has recorded 192 deaths. Joining me now via Skype is Dr. Osaho Enabulele. He is the President, Commonwealth Medical Association. Dr. Enabulele, it's good to have you join us right now. Now, health experts are saying that Nigerians should prepare for the worst. When we talk about the worst, what can the worst even look like?
Well, I honestly do not think that people should be unnecessarily alarmed because, again, these are all based on projections. The projection may not be in tandem with reality, as we are beginning to see in most parts of Africa. We were told that people were going to be littering the streets and all of that. So I think the experience from other countries suggests that there's always that possibility of having a second outbreak or a second peak, if you like, after relaxing your measures. So perhaps that is what people are apprehensive about. But I think what is important is your containment measures and how effective they've been in determining, the projections for the future in terms of the prognostic, factors, in terms of forecasting, what tomorrow will look like or what the next few months will look like. So I think for us, rather than getting alarmed with, some projections made by individuals and groups, what is important is the evidence we have in our country. And thank God, there's some recommendations that we made at the beginning of our site visitations to some of the countries in the Commonwealth, including Nigeria, for the constitution of an expert committee has yielded fruit in Nigeria, for instance. Nigeria now has at least an expert committee that should guide, their interventions going forward. So I think unless and until we hear from our own indigenous experts in terms of how they perceive of the condition, in terms of their, projections for the future, I think it is important that we allay the fears of Nigerians, we allay the fears of the people of the world, and manage it as, according to our evidence.
All right. We certainly listen to the WHO when they come up with data and projections. Sometimes it is good you're saying no one should be unnecessarily alarmed. But the point there is when it comes to planning and data and evidence and facts, one way or the other, everyone agrees that the health system in African countries or sub-Saharan African countries are generally weak, which make them susceptible to the impact of Covid-19. But if we look at being proactive, what do you think the government should be doing at this time?
Well, like I've always said at other fora, I think we've come a long way, from what looked like a very phlegmatic approach at the very beginning, in terms of the sloppy response we saw all across Africa, including Nigeria, to a point where we seem to have braced up to the reality of the COVID-19 pandemic in terms of facing up with the challenges through appropriate strategic responses, which still needs to be scaled up. So I think for me, the deficiencies that have been identified thus far, especially when you look at some of the indicators, suggest that we still need to do a lot more of public communication. We still need to do a lot more of public enlightenment and risk communication, particularly in the rural settings, in the suburban and rural communities where it looks like it's still business as usual. So it is not all about cities. It is not all about the urban, cities, but government should now move its own, communication strategies to, of course, influence behavior change in the rural communities, in the suburban communities. And I think the government agencies vested with that responsibility should be up and running to ensure that they not only do that, but also galvanize other groups and coalitions, including the civil society organizations, the professional bodies, to reach out to the grassroots so that there's some level of improved grassroots communication, grassroots mobilization and social mobilization to ensure that people grapple with the reality of this challenge. Because right now we're having, we've since entered the phase of community transmission. And one way to block that is to ensure that people observe the appropriate guidelines in terms of respiratory hand hygiene and social distancing. So all this needs to be communicated to the rural communities, and of course, bearing in mind that we still have a very unsatisfactory health literacy level in our country, we need to, of course, move into that. And of course, the issue of ensuring that health workers are protected. Health workers remain the frontline soldiers in contending with this scourge. So up till now, we still have the issues of inadequate supplies of personal protective equipment. We still have the issue of health worker exposure, to COVID-19. And when you lose a lot of your workers, a lot of your healthcare workers, and bearing in mind that we already have a very major debt in the numbers of healthcare workers in our country on account of the phenomenal brain drain, then we need to do more to emphasize, to prioritize their protection. So both those who are working at the isolation centers, both those who are working in health facilities, who largely see undifferentiated cases, especially the family physicians, the primary care physicians, who see undifferentiated cases, should even be given priority in terms of donning them with the appropriate personal protective equipment, rather than, of course, leaving them to, of course, care for themselves. So this has to be focused so that we can have the effective management of the cases that present at the centers. Again, is the issue of ensuring that the vulnerable population is well protected. Just now, there's still a lot more that needs to be done. Yes, the government of Nigeria and indeed some other African countries have tried to, of course, roll out palliatives. But the question is, to what extent? Nigeria, for instance, has over 90 million people in the poverty line, in fact, in the extreme poverty bracket. So doling out palliatives for perhaps close to about 10, 11 million is really insufficient. So a lot more needs to be done to cater for the needs, of the vulnerable population. And fundamentally also, we must ensure that going forward, that the primary care points in terms of the PACs are expanded.
All right.
Because right now, while we are grappling with the capacity of our health system, we've forgotten that a lot more would have been, salvaged if we had proper, efficient, and well-run primary healthcare systems.
All right.
In terms of the primary healthcare
Dr. Nabulale, because of time, we have to leave it here, but these are really cogent points, and this discussion will certainly continue. Thank you very much, Dr. Osaho Nabulale, President, Commonwealth Medical Association.